Good morning, everyone. Good morning, all my dear PGs. And I'm back with another episode of Nice to Know Areas. And today we talk on prophylactic antibiotics during C-section. Traditionally, during C-section, the antibiotics were given after the cord clamping. And what were the reasons behind this was that it would exposure of the fetus to antibiotics would mark the newborn positive culture reports, or it would cause antibiotic resistance, or there, if in case of maternal anaphylaxis, it will avoid the fetal compromise. So avoiding all these factors and taking into all these concerns, antibiotic usually were earlier given after the cord clamp. Now, it has been shown that if antibiotics are given prior to skin incision, what does it do? It reduces the risk of urinary tract infection, post-operative endometritis, and surgical site infection by approximately 50%. And that also has been observed. There was no increase in neonatal sepsis rate if we give prophylactic antibiotics before skin incision. Now, what are the recommendations and what are the suggestions according to ACOG? Antibiotic prophylaxis should be given for all C-section patients, and it should be given before skin incision, at least one within 60 minutes, so that maximum level of antibiotic is reached by the time of incision. And if it is not possible to give within 60 minutes of skin incision, then should be administered as early as possible after the incision, or whenever you decide in cases of emergency C-section. Now, how do we give and what are the doses and what are the routes? For normal BMI patients, that is weighing less than 80 kg, 1 gram cefazolin within the 60 minutes of incision. And in those cases who are overweight, we give 2 grams cefazolin. Those patients allergic to cefazolin can take clindamycin and aminoglycoside. Now, another evidence that shows that azithromycin can be an alternative or an adjunct to first-generation cephalosporin for patients undergoing emergency C-section. So those patients who are going to emergency C-section, azithromycin can be added, or it can be given single alone as a 500 milligram dose. And those obese individual who did not receive IV azithromycin, another consideration should be like giving 500 gram oral cephalexin and 500 milligram oral metronidazole every 8 hours for 48 hours. They should receive these antibiotics for 2 more days. And those procedures who have taken more than 4 hours should receive intraoperative extra dose. And those patients, those operations which had blood loss, excessive blood loss, should also receive extra dose of the same antibiotic during intraoperative period. Thank you so much for listening. Hope this was helpful to you all. Have a nice day.